MCRT, this is Lauren.
The phones ring often here in Telecare's Mobile Crisis Response Team, or MCRT office in Mission Valley.
Good day to you too.
The people answering are skilled behavioral health professionals who are ready to listen, counsel, and take action.
Okay, so it sounds like she's saying things like she wish she wasn't here anymore.
Their reassuring voices are the first step in a new, coordinated approach to connect with people who are not a threat to themselves or others, but are experiencing a mental health or substance abuse crisis. It's an alternative to PERT, or Psychiatric Emergency Response Teams, that include a uniformed officer on each call.
CRT3 out. Christian, let's roll.
The families are desperate for someone to come and they're scared.
For the friend, family member, or concerned observer on the other end of the call, this is a much-needed alternative.
Then I'll take the lead. We specialize in mental health crises that don't quite meet the level of needing a PERT clinician. Our ETA is 10 minutes. Maybe they just need someone to help them de-escalate. We can take them to the hospital if needed, or give them resources to be able to stay at home and out of the hospital if needed. She literally just got out of jail. It kind of is like a double crisis, like she's in a mental health crisis, but she's also having a potential housing crisis.
You've arrived on scene. We'll keep you updated.
Wonderful. Thank you so much. And let's make a difference today.
Once the team connects with the client,
Are you Jennifer? Hi, I'm Bree.
they ask questions,
Do you have current housing or no?
make an assessment, and create a plan of action that is responsive and respectful.
Well, tell me about that. Who wants you dead?
People don't like me because they think I'm like the other girls that like don't have hair or are talking to themselves and shit, and it's not. They compare me to other people. So then now I'm on my right meds.
Got it.
I'm actually able to just like sit still.
MCRTs can help people manage medications and refills, and will also follow up on their clients after their initial contact.
That is a super unique part of MCRT, is we're able to provide 30 days post-intervention. So for example, if we've served a minor before who wasn't connected to any services, we were able to come alongside her and her family, introduce them to resources that are available in the community for teens that are struggling. Are you hungry? You're not hungry? We've also served adults who are already connected within the behavioral health system, but for some reason there's been a disengagement from the member to the program. After the hospital, we'll help connect with Vida. So we just got to call them, the CSU, to make sure they got a place for us, okay?
What area is it in?
You know, they're in a crisis, so we just want to be there and support them and help them in any way we can.
You can sit right here.
So as soon as you are out of the CSU, Jennifer,
Yes.
they're going to get you set up with transportation to be taken directly to your housing, okay?
The MCRTs know these people who are struggling, scared, and vulnerable require patience, constant reassurance, and flexibility. And even then, things don't always go as planned.
We're going to help make sure that you get the right meds.
I'd rather be on the street.
Can I show you something? So when I spoke to them, they asked what medications you took.
Can I go back, please?
For Jennifer, a reassuring phone call from a housing manager she trusted was all she needed.
We cannot admit you at the independent living home until you become more stable at your baseline, okay? And we'll get you your medications there at the independent living home, okay?
Okay. Okay, all right, thank you. Bye, Roberto.
We went on a call earlier today for a member who was connected to the vida program. She needed to get stabilized on her medications. So with that, we were able to reach back out to her care team at vida, have the housing coordinator speak to her very briefly and let her know kind of the game plan they needed, and she was very receptive and accepting to that. So it was a success in that regard.
This, I think, is the most critical piece that's been missing in the behavioral health system. I truly think that this program already has and will continue to make a huge impact on the community.
One phone call at a time.
MCRT, this is Maddie. How can I help?
In the County News Center, I'm Anita Lightfoot.